Thank you very much. It is indeed a great honor to join you today and to have a chance to provide you with an update on the KGH story, a story that is still unfolding. I think if we were in a bookstore, you would find the KGH story in the adventure section, or perhaps the self-improvement section. Either way, it's a story worth telling and a story worth embracing. As many of you know, KGH has had its share of tough times. In fact, when the hospital was first built, there was no money to run it. It was the sheer determination of a small group of people who literally begged others for money and shared in the responsibilities of administration, cleaning, and caring for patients. At that time, the doctors worked for free. Now, I'm not proposing we adopt all those strategies today, but there are some lessons here. First, when you have an unwavering focus on patients and their welfare, you can weather any storm. Second, when you commit yourself to a cause that you believe in and rally the support of others, anything is possible. These lessons are as true today as they were 100 years ago. I sometimes wonder what our founders of KGH would think of where we are now. While they definitely had a vision that they set out to achieve, I'm sure they never would have imagined that KGH would have over 4,000 clinical, administrative, and support staff delivering excellent care in buildings that span over 1 million square feet, that we would have 160 researchers, that we would be named as one of Canada's top 40 research hospitals, that we teach over 2,000 students from 35 different education institutions, and we manage budgets of over $500 million every year. They would be in awe, I think, of the highly complex and specialized programs that we provide for people of Kingston and the surrounding region. And they would admire the high degree of collaboration that we enjoy with our colleagues across the region to help create a seamless continuum of care for our patients. I think it's fair to say, however, that they would not have been impressed by the headlines in the papers in 2008. I'm sure you all remember. It was a time when the hospital took a very public fall. Our shortcomings were on display, and it was a very difficult time for people inside the organization and for the community. But it was a time of reckoning, and the message from our government was clear. We expect you to take ownership of the challenges you are facing. We expect you to fix the problems that you have created and get on with fulfilling your potential as one of Ontario's leading academic health science centres. We're counting on you to succeed, they said. That was a lot to swallow. I don't know about you, but I'm a firm believer in the notion that it is not whether you fall down that defines you and that really matters, because we all do. But it is how you get up from that fall that defines your character as an individual and as an organization. And when I look at the past 3 years in that light, I can say with great pride that yes, KGH did fall, and we were bruised, but we have faced our realities, taken a hard look at what we do, how we do it, and set ourselves on a very positive and healthy path. And boy, have we delivered. I am incredibly impressed by the sheer resolve, determination, and discipline that people throughout the organization have shown in order to get the job done. And while we still have a lot left to do to improve, and to meet the ever-increasing standards that we are setting for ourselves, I want to take this opportunity today to lay out some of our achievements for you so that you too can share in some of the pride that we are now feeling about what has been accomplished at KGH over the past 3 years. I'm also going to give you a bit of insight into how we've moved through this pivotal transition period and what you can expect from us going forward. It would have been easy to simply follow a 3-year performance improvement plan that had actually been set by government when the supervisor left as our blueprint for moving forward. There were specific targets that needed to be achieved, like balancing the budget, reducing sick time, and addressing our problems of high numbers of patients in our alternate care level of care beds. We did have plans in place to deal with those issues. But what I learned from people in the conversations I had when I arrived is that people wanted more. They wanted to know what the long-term vision was and what they could really count on being part of for KGH in the future. They wanted to know that they weren't just spending their time and energy fixing old problems, or just reaching targets that others had already achieved, but truly doing things that would set KGH apart and inspire people to get up and going in the morning, and something that would energize us and give us our place in the sun. So we did set out on a journey to create that vision and to put a strategy in place that would guide us going forward. We engaged over 2,000 people in a process both inside the organization and outside the organization to have conversations about what was important to people going forward. And we listened. And we learned a lot. Some of the conversations were actually difficult to hear. There were people who were very frank and bold and said, these are the things that need to change. We took that to heart and we incorporated it into the strategy because we knew in order for us to be successful, we couldn't set our goals so high that we would never get there, and we needed to put changes in place that would be meaningful to patients and families and people in this community. The engagement process really laid the foundation for what we now call KGH 2015. I still meet people on the street who were part of that engagement process who say, so what happened with my idea on X? And the wonderful thing is we can point right now and say, this is what we've done with your idea, and this is how we're building on it going forward. Our aim as expressed in KGH 2015 is straightforward. Outstanding care, always. For every patient, every day. That's what we're working toward. That's what we're putting plans in place every day. Our mission is an expression of our collective purpose, to come together as a community of people to transform the patient and family experience. It's patient-centered. It's focused on innovation and collaboration in all aspects of our care, knowledge, and leadership. So what does this really mean? It means we'll be pace setters and leaders in high-quality care and putting patients at the center of everything we do. We will be pioneers in the use of knowledge to improve patient outcomes. We'll generate new knowledge through research and facilitate the translation of that research into practice. It means we'll be agents of change, leading by example as high performers and champions in health system reform. A set of 5 guiding principles have really been at the heart of the organization now, guiding everything that we do. We've made a commitment to bring those principles to life in our decision making and in the choices that we put forward and in our behavior and in our day-to-day work. They are respect for each other, engagement, accountability, transparency, and value for money. We weren't actually sure when we went out and asked the community how the notion of value for money would fly as a guiding principle for the organization. But there were a lot of you who told us, we expect you to make the best use of every dollar that is entrusted to you. And value for money, value for patients means the best possible care with the resources that you have. And we've taken that advice to heart as well. We have 4 big strategic directions and lots of action plans in terms of how we're going forward. And as Chris did say, the notion of putting the landing gear on the great ideas has been a big part of bridging the gap between dreaming and delivering. Warren Buffett also said that leaders are dreamers with deadlines. I like that one too. So what have we actually achieved so far? Well, one of the most significant commitments that we made in the strategy process as a result of the advice that we got was to be more patient-centered. And it's kind of incredible when you think, well, why wouldn't a hospital be patient-centered anyways? But in fact, there's all kinds of things we've been doing every single day that aren't centered on the needs of the patients. They're around the convenience of the providers and of the organization. So we wanted to make sure that patients could actually become part of the life of KGH in a new way. We made a commitment that patients and families would be represented on every council, every decision-making body in the organization, where we were talking about and making a significant impact on that patient and family experience. We created a patient and family council, mostly made up of people who actually had terrible experiences at KGH. Some of their stories were truly heart-wrenching. But what has happened is that they have decided on their accord to work with us to help us move forward, to help us apply the lessons learned so that the experience for other patients can be very, very good and better. We now have 27 patient experience advisors on councils, committees, and we've even put them on hiring panels for our staff. So these folks are making a profound difference in the organization. And one of the very specific changes that we've made just recently, because of we got a lot of feedback that people couldn't tell who was caring for them, whether they were a nurse or a physiotherapist, or they couldn't read their name tags. So we now have brand new name tags with big first names there and the roles on both sides of the name, so you can't even flip it over. And that is one small but important thing that we're getting a lot of feedback on now, of saying that's positive. And that was our Patient and Family Advisory Council that said, here's something that we want to see different. As part of our commitment to eliminating all preventable harm to patients, to make the environment as safe and as high quality as possible, we've zeroed in on reducing hospital-acquired infections. I'm pleased to report that our infection rates are down significantly. We have new prevention measures in place, and we are able to respond quickly and effectively when problems do arise. That's because we've put our attention to changing things that contribute to infections. Our hand hygiene rates, washing your hands before you see a patient and after you see a patient. You'd think we'd have this one all nailed down as well, but we didn't. Our hand hygiene rates were 34%. Unacceptable. Our hand hygiene rates today, 2.5 years later, are 92%. And we're striving for 100. We're not resting until every day this is the standard by which that we work and the standard that you can expect. We've implemented new environmental cleaning standards. We've hired more cleaning staff. We've put rigorous audits in place to make sure that the standards that need to be achieved are being met. We also worked hard to convince government that the carpets needed to go to keep people safe. We received $7 million to replace the flooring on every single patient area. We are now about 25% through that carpet replacement and removal program. And if you go on to one of the old units now, up on Connell 7 was one of the early ones, and you go on that unit, the walls have been painted, the floors are shiny, the staff are smiling, the patients and families love it. It's brought a boost of pride and really helped make the environment feel very much similar to what the environment is even in our newly redeveloped areas. So by the end of all the carpet removal process, we will have removed almost 5 football fields of carpet will have been ripped away from KGH with great delight. We've also made improvements on reducing wait times. Almost 90% of our patients now get their surgeries within recommended wait times. People are not waiting as long in the emergency department, although people are still waiting longer than they should be at this point. But we have plans in place, we're working hard, the teams come together to make sure that the experience of patients is much quicker than before. One of the other things that we've done in terms of progress is that for patients who need alternate levels of care, getting out of our acute care hospital and into their home, into long-term care, or with the community supports that they need, is that those numbers of patients has significantly reduced over time. 3 years ago, we had 60 people in acute care beds waiting for long-term care and waiting for community supports. Today, we have 22. That's a huge improvement that's been made as a result of the teamwork of our staff with the community, working together with families to plan in a different way so that we can get people home where they belong or with the community supports and not being inside the hospital, which is the worst place you can be if you don't need to be there, and to make sure that people are safely transitioned to the environments that they need to be in. We've also changed our model of care. We've introduced what's called an interprofessional model of care, where team members come together to deliver and coordinate care in a new and different way. We've trained over almost all of our staff, the physicians, the support staff, the nurses, in working in this new model of care. Patients and families have been part of advising us in the development and in the evaluation of how well it is working. Patient satisfaction is improved, staff satisfaction on these units is better, and teamwork is the norm. One of the key decisions the board made as part of the strategy focus was also to turn our attention to research and improve our performance in this area. This is a vitally important contribution that we need to be making as an academic health science center. So we took an idea of establishing a KGH Research Institute, and we've made that happen. We now have a KGH Research Institute, increased the number of new clinical trials coming into the hospital by 32%, and we have been getting more and more external funding for research grants from our excellent researchers. And this is an area where we will be working continuously with Queen's and others to advance in this area. An organization that's focused on research is able to attract some of the absolute best in the world staff that come and help advance discoveries that are really going to make a difference to patient care. And they come to environments where they feel supported and enabled, and I'm really proud of some of the people that we're attracting now and the work that is being done. We're also increasing our focus on complex acute and specialty care in order to best suit the needs of people in our region. We meet with the other hospitals and the community care centers in our region on a regular basis. We talk about who does what. We make sure that one hospital, all the surgeons don't go on holidays while somebody else is picking up the work somewhere else. And we are trying to coordinate all the issues that relate to the transition of patients in the region, to make sure that we're not duplicating things that don't need to be duplicated, and to really focus on being excellent in certain areas. So I'm very pleased with the positive and constructive relationships that KGH has with the many people locally and throughout the region. So how have we done on the financial front? Well, in the first 2 years, we saved $20 million, generated a threefold increase in the annual capital spend. So that's the money that's available to invest in capital equipment and new technology. And we've improved our working capital status. With less than 3 months away from our current year end, I can say with confidence that our operating budget will be balanced. We will have generated $12 million a year to spend on new technology and capital equipment. On modernizing the facilities, we will have paid down almost $6 million of long-term debt. And that is a result of a lot of hard work of many staff. There isn't anyone in the organization who has not contributed to the achievement of that goal. It was not a paper exercise. It was not just pulling money exercise. It was people thinking about how can we do things differently? How can we be smarter? How can we be more efficient? How do we get the best bang out of the dollars that we're spending? And how do we change to deliver the most value for our patients? And I'm very, very pleased and proud. And the organization is on and will continue to be on solid financial footing going forward. Our facilities are being expanded. We had a $196 million capital redevelopment project. It's about 97% done. It's on time, it's on budget, and the facilities are spectacular. If you've had the chance to be in, for you or any of your family members, it's just simply wonderful. The new dialysis units, the new oncology inpatient units, the expanded critical care facility, the cancer center is simply breathtaking, the environment that now is there for patients. And the new mental health unit, which now we have welcomed the mental health patients in the mental health program from Hotel Dieu into KGH, and the facilities there are simply world class. What one of the staff has said to me that I'm always reminded of is that finally the facilities match the great quality and the spirit of the staff to be able to provide the care to patients. And it is really a big lift for everybody's confidence and capabilities. We are continuing on the, as I said, with the removal of the carpets throughout the whole organization. The front lobby is already looking new and bright and cheery, and we're almost finished renovations there. So when you walk into the place, it's going to look and feel different, including no carpet there. And we've also been given the go-ahead from government to start planning for Phase 2 redevelopment. So one of the important jobs that me and my team have had is to make sure that we're always positioning the organization forward. So Phase 2 will involve brand new operating rooms, a whole new neonatal intensive care unit for the very, very sick babies that no one else in the region is taking care of, a whole new labor and delivery area for birthing suites for mums that right now we have very, very old-fashioned facilities, and brand new laboratories. All of these facilities are critical to our success going forward. Through all my travels in my career, I have never seen an operating room ever that has wooden doors in the operating room. And KGH has wooden doors in our operating rooms. Not every operating room, but we have them, and we must modernize and improve. And in fact, I was talking to someone yesterday morning, and they said, that's a great idea for a fundraiser. You could auction those off, and I bet someone would love to have those as a door of historical significance. So I'm going to keep that in mind. We're also introducing new food services. People have told me, and I think the last time I was here too, I was asked, what are you doing about the food? Well, we know the satisfaction levels with our food have been very low, both from a patient and family and from a staff perspective. And we are implementing a whole new modern way of delivering food, and the quality is phenomenal. The first servery is opened we're opening up 2 patient units with the new food services next week. And then throughout the next couple of months, it will be rolled out through the entire hospital. And there'll be brand new food services, healthy food choices for staff and visitors as well at the hospital in our renovated cafeteria. And we expect to see a swift uptick on our satisfaction levels with food, which is now at about 45%, and we expect it to jump right up to 80 or 90%. How are our staff doing? As you can tell, there's been a lot of change. We've kept a fast pace. We've been really focused on results, deliverables, accountabilities, and we've asked a lot of people. I have an incredible leadership team that is working with me, and each of them have very strong and capable teams working with them. But we've changed many processes. We've tried to make it easier to get things done. We've implemented new staff and leadership training programs, new wellness initiatives, and we've taken lots of advice from a frontline staff group, a team spirit group, that leads a lot of the fun things that are starting to happen at KGH. And starting to have fun is a good sign. I describe the character of the people in KGH now and the overall organization. I think we're an organization that is really focused on and has a lot of integrity, compassion, and resilience. Our spirit's getting stronger, and some of that negative energy that was palpable just a short time ago is gradually being replaced by what I would say is a cautious optimism. We're not all dancing in the streets yet, but we are moving forward, and the more and more confident people get in the fact that we're realizing the objectives that we've set, we're accomplishing goals, we're celebrating, and people start to have a bit of lighter step and more smiles around the place, and people then become more comfortable with continuing to take risks and moving forward, and so that we can achieve the many things still that we have left to do. All this bodes well for the future. We're proud of where we are, and we'll continue to execute our plans to achieve additional outcomes for 2015. We're also well equipped to weather any future storms. The environment in this province will continue to change. There will be new expectations of all of us in a very tight fiscal environment to deliver more value for our patients, discover new and better ways of working together with others to improve quality and reduce the cost of care. I want you to know that we're strong and we're ready for those challenges. KGH is standing tall again, and I hope you share in the pride of what's been accomplished thus far, and that you continue to stay in touch. We've got new ways of communicating with people. We're now posting every quarter, every 3 months, the results that we're achieving on all of the kinds of indicators and more that I've spoken to you about today. You can watch videos that tell you about how we're doing. You can read the reports. We're putting it out there so that you and others can learn from that, ask us questions, and come up when you have ideas about other things that we could be doing better. We really want to hear from you. We want our community. We've been very, very pleased and humbled by the support that the community has given our hospital through the redevelopment, through the tough times, and we want to continue to have you by our side as we move forward. And so we're going to continue to get even better. We're going to realize the ambitions and the dreams that we have, so that KGH is truly a standout organization in a field of some excellent, excellent providers and academic health science centers in Canada. We already have people calling us to find out about things like our Patient and Family Advisory Council and our Patient Experience Advisors, because now we're not just catching up, but we're actually leading the way. And when people discover how we've truly embraced the notion of patient-centered care in a whole new way, they're saying, wow, I've got to go and learn from KGH. That feels great. And our staff are proud, and we've got much more to do. So stay with us and stay tuned for the next chapter in the never-ending story of KGH. Thank you very much.